Listen closely. What I'm about to share with you could one day save your life. Every single time you use the bathroom, your body may be sending an important message, yet most people simply flush and move on. They never realize their body was desperately trying to warn them, and ignoring that warning could have devastating consequences. I know this may sound frightening. I'm Dr. Sarah Miller. Let me tell you something. I've witnessed this far too often throughout my career. People overlook the warning signals. They assume everything is normal. Then one day they're diagnosed with cancer, and by that point, it's frequently too late. Here's the reality very few people discuss. Your stool works like a health report for your body. It reveals what's happening inside. The color can tell you about your liver, your pancreas, and whether internal bleeding may be occurring. The shape can reveal if something is narrowing your intestines, even a tumor. But here's the most alarming part. The most dangerous type of stool often appears almost normal in the beginning. You may glance at it and believe everything is perfectly fine. Meanwhile, something serious could be developing inside your body. That brief moment when you look into the toilet before flushing, that single moment might save your life. Today, I'm going to explain exactly what you should be watching for. I'll show you which kind of stool is the most concerning, and I'll explain when you should head immediately, not eventually, to the emergency room. But I'm not here simply to frighten you. I'm going to provide practical solutions. Easy steps you can start today to help protect your health. Strategies that can help even if you're taking prescription medications, even if mobility is difficult, and even if you're living on a limited income. The final two tips are so effective, they could dramatically improve your health within only a few weeks. But before that, you need to understand something essential. Most people don't actually know what healthy stool should look like. No one has ever explained it to them. People avoid discussing it. It feels uncomfortable. It seems unpleasant. So we simply avoid the subject. That's a major mistake. Let me explain this as clearly as I can. Doctors rely on something known as the Bristol Stool Chart. You can download this chart online for free and place it inside your bathroom cabinet. Simply search for Bristol Stool Chart and print a copy. It ranges from number 1 through number 7. Number 1 resembles small hard pellets, similar to rabbit droppings. Number 7 is entirely watery with no solid form. Here's what you should know. Your stool should normally be brown. It should be soft yet well-formed, shaped like a sausage. Not overly firm, not excessively loose, just smooth and comfortable to pass. When it appears this way, your digestive system is functioning properly. But why is it brown? Because the food you eat combines with a substance known as bile. Bile begins as a green fluid. As it travels through your digestive system, it gradually becomes brown. That brown color tells you everything is working the way it should. Ideally, you should have a bowel movement at least once each day or every other day, preferably around the same time. If you're going less frequently than that, or if your pattern suddenly changes to much more or much less than usual, that's an important warning sign. Now here's where things become more serious. Healthy stools should come out with a normal width, approximately as thick as your thumb, perhaps a little wider. If your stool suddenly becomes narrow, like a pencil or a thin ribbon, something could be compressing it. Something could be obstructing the passage. And that obstruction could be a tumor. I'm not saying this just to frighten you. I'm sharing it because most people simply don't know. They notice narrow stool and think, maybe I'm just constipated. They wait. They hope it improves on its own. Meanwhile, if cancer is the cause, it continues growing larger every single day. If you notice pencil-thin stool more than twice within 1 week, contact your doctor's office the following morning. Don't wait until your routine appointment. Tell them you need to be seen soon because your bowel habits have changed. Those words usually get their attention. Let me tell you about the most dangerous type of stool you could ever see. If your stool ever turns black, truly black, resembling tar or used coffee grounds, stop everything. This is a medical emergency. Black stool like this often means you're bleeding internally. Somewhere in your stomach or intestines, blood is leaking. As blood remains inside your digestive tract, it gradually turns black. This could result from an ulcer. It could come from damaged blood vessels. Or it could be caused by cancer. And here's the frightening reality. If enough blood is present to turn your stool black, you're losing a significant amount of blood. Your life may be at risk. If you ever notice black tar-like stool, call 911 or have someone drive you to the emergency room immediately. Don't wait until the next morning. Don't wait to see whether it happens again. This situation is every bit as serious as chest pain. Now, I need to point out something important. If you're taking iron supplements or Pepto-Bismol, these can also make your stool appear black. But here's the difference. Medication-related black stool usually looks darker with a grayish tone. Blood-related black stool appears shiny and sticky, similar to tar. If you're uncertain, go to the hospital anyway. It's always better to be cautious. Another important warning sign is blood. If you notice bright red blood in your stool, on the toilet paper, or in the toilet bowl, don't ignore it. Sometimes it's simply hemorrhoids, nothing dangerous, but sometimes it could be a polyp or cancer. The problem is you cannot tell the difference by appearance alone. Here's what you should do. If you notice bright red blood once, and it's only a small amount, contact your doctor within the next few days. If you notice blood more than once, or if there's a large amount, call your doctor that same day. If you notice blood along with dizziness, weakness, or extreme fatigue, that's an emergency. Go directly to the hospital. Don't try to push through it. Here's another thing that deserves your attention. If you're having bowel movements much less often or much more often than usual, something isn't right. Constipation lasting longer than 2 weeks should always be evaluated. Diarrhea lasting more than 4 weeks may indicate a serious intestinal condition. It could be parasites, it could be inflammation, it could even be cancer. And here's something many of my patients are surprised to learn. Many commonly prescribed medications contribute to constipation. Blood pressure medications, pain medications, antidepressants, iron supplements, and calcium supplements may all slow your bowels. If you recently started a new medication and suddenly became constipated, let your doctor know. Sometimes they can prescribe a different medication without that side effect. Never stop taking your medication without speaking to your doctor first, but always bring up the issue. Now I'm going to share 5 important strategies to help protect your health. These are straightforward recommendations I regularly give my patients, yet they can make a tremendous difference, and I'm going to explain exactly how to put them into practice, even if you're dealing with the challenges that many older adults experience. Secret number 1 is to stay physically active every day. If you remain seated all day, your intestines become sluggish. They stop functioning efficiently. But here's the encouraging news. You don't have to run long-distance races. Even gentle daily movement makes a difference. If you can walk, try to walk for just 10 to 20 minutes a day. It can be inside your house, around your yard, or at the mall. If you use a walker or cane, that's fine. Just keep moving. If you can't walk, well, you can still help your intestines. Sit in a chair and march your legs up and down for 5 minutes. Do arm circles. Rock side to side. Any movement tells your intestines to wake up and work. The best time to do this is in the morning, right after breakfast. This gets your bowels moving for the day. Secret number 2 is stop eating junk food and start eating food that heals your gut. I mean it. All those chips, cookies, frozen dinners, packaged snacks, and hot dogs, they're poison for your intestines. Processed meats like sausages, bacon, and deli meat actually cause cancer. Science proves it. But I know what you're thinking. Healthy food is expensive, right? Wrong. Here are cheap, healthy foods that help your gut. Bananas cost about 20 cents each. Apples are cheap, especially when in season. A big container of oatmeal costs $3 and lasts 2 weeks. Carrots are one of the cheapest vegetables. Beans from a can, or under $1. Eggs are cheap protein. Brown rice costs pennies per serving. Frozen vegetables are just as healthy as fresh, and they don't go bad. You don't need fancy organic food, just real food. Food your grandmother would recognize. Here's an easy rule. If it comes in a box or bag with more than 5 ingredients you can't pronounce, don't eat it. Let me give you a simple meal plan that's cheap and helps your gut. For breakfast, have oatmeal with a sliced banana and a sprinkle of cinnamon. Or have scrambled eggs with some cooked vegetables. For lunch, have bean soup with carrots and onions. Or a sandwich with real turkey or chicken, not processed meat, and add lettuce and tomato. For dinner, have baked chicken with brown rice and steamed frozen vegetables, or fish with a baked potato and salad. For snacks, have an apple, some carrots, or plain yogurt. Drink water with every meal. This kind of eating doesn't cost more. It actually costs less than eating junk food, and your gut will thank you. Secret number 3 is to get rid of parasites once a year. You might think you don't have worms or parasites, but millions of people do and don't even know it. These parasites steal your nutrients. They make you tired. They can cause diarrhea or constipation. They can even cause serious diseases. The medicine to kill parasites is cheap and safe. It's usually just 1 or 2 pills. Ask your doctor about it at your next visit. Say, "I'd like to take deworming medicine just to be safe." Most doctors will write you a prescription with no problem. You take it once and you're protected for the year. If you have pets, you should definitely do this because pets can pass parasites to humans. Secret number 4 is get a colonoscopy after you turn 50 or sooner if you have symptoms. I know, nobody wants to do this. The prep is unpleasant. You have to drink that awful liquid and stay near the bathroom. But listen to me. This test saves lives. I've seen it save countless patients in my years of practice. Colon cancer usually has no symptoms until it's too late. A colonoscopy can find cancer when it's still tiny and easy to fix. It can find polyps before they turn into cancer and remove them right then and there. If you're worried about the cost, here's what you need to know. Medicare covers colonoscopy screening at no cost to you if you're 65 or older. That means zero copay, free. If you have other insurance, most plans cover it too. If you don't have insurance, many hospitals offer payment plans or charity care. Call the hospital billing office and ask about financial assistance. Don't let money stop you from getting this test. And if you're scared about the procedure, talk to your doctor. They can give you medicine to help you relax. Most people say the prep is worse than the actual test, and they don't remember the test at all because of the medicine. And now, the most important secret of all, secret number 5, is take care of your gut bacteria every single day. Inside your intestines, you have trillions of tiny bacteria. Good bacteria, they're like an army protecting you. They help you digest food, they fight off diseases, they make vitamins for your body, they even control your mood and energy. When these bacteria are healthy, you feel good. When they die off, you get sick, you get tired, you can't fight off infections, your digestion stops working right. But when you take antibiotics for every little cold, you kill these good bacteria. When you eat junk food, you kill them. When they die, bad bacteria take over, and that's when you get sick. So, how do you feed these good bacteria? Here's exactly what to buy at the grocery store. Get plain yogurt, not the kind with fruit or sugar. Plain yogurt. The label should say, Live Active Cultures or Probiotics. Good brands include Dannon, Yoplait, store brands, any plain yogurt with live cultures. Eat half a cup every day. You can add your own fruit if you want it sweeter, like banana slices or berries. If you can find kefir, that's even better. It's like drinkable yogurt. You can also buy probiotic pills at the pharmacy, but food is better and cheaper. A big container of yogurt costs $3 and gives you a week's worth of probiotics. Now you also need to feed those good bacteria. They eat something called prebiotics. These are foods that humans can't digest, but bacteria love. Here's what to eat. Bananas that are still a little green, not fully ripe. The greener they are, the better for your bacteria. Apples with the skin on. Never peel your apples. The skin has good stuff. Oatmeal or oat bran. Eat it every morning. Onions and garlic. Add them to everything you cook. They're cheap and powerful. Beans of any kind. Black beans, pinto beans, chickpeas, lentils. These are superfoods for your gut. Whole grain bread or brown rice instead of white. These simple foods cost almost nothing, and they make your good bacteria strong and healthy. When your gut bacteria are healthy, everything else gets better. Your energy goes up, your mood improves, you get sick less often, your digestion works smoothly. It's like magic, but it's science. Here's what I want you to do starting today. Every single time you poop, look before you flush. Just for 5 seconds. Keep a small notebook in your bathroom. Write down the date and what you see. Is it brown? Is it soft and formed? Was it easy to pass? This takes 10 seconds, but gives you a record. If something changes, you can show your doctor your notes. They will take you much more seriously when you have written records. This is something I always recommend to my patients. Ask yourself these questions. Is it brown? Is it soft but formed like a sausage? Does it come out easily without straining? Am I pooping at least every other day? If the answer is yes to all of these, you're probably fine. Keep doing what you're doing. But if you see these danger signs, take action immediately. Black terry poop? Go to the emergency room now. Bright red blood more than once? Call your doctor the same day. Pencil thin poop more than twice in a week? Call your doctor within a few days. Can't poop for more than 2 weeks? Call your doctor. Diarrhea for more than 4 weeks? Call your doctor. Any sudden change that lasts more than a week? Tell your doctor. Don't be embarrassed. Doctors talk about poop all day long. It's our job. We need to know. And here's something else important. When you call your doctor's office, you might talk to a nurse or receptionist first. If they try to schedule you far in the future and you're worried, say these exact words. I'm having red flag symptoms. I need to be seen sooner. Red flag symptoms is medical language that gets attention. They'll move your appointment up. Your body talks to you every single day through your bowel movements. The question is, are you listening? Don't be like most people who ignore the warning signs. Don't wait until it's too late. You have the power to catch problems early when they're easy to fix. Start paying attention today. Print out that Bristol Stool Chart. Keep that notebook in your bathroom. Add yogurt and bananas to your grocery list. Take a 10-minute walk after breakfast. Call your doctor and schedule that colonoscopy if you haven't had one. These simple actions could add years to your life. Your family needs you. Your grandchildren need you. You deserve to feel good and stay healthy. So, please, starting right now, pay attention to what your body is telling you. Your life might depend on it. I'm Dr. Sarah Miller.